Hello, Alexander. I see that you are currently at your workplace.
Yes, indeed, I'm doing well.
Could you please tell me where you work and who you work with?
I work in Hungary, in the city of Zalaegerszeg, at the regional hospital as an orthopedic surgeon.
Great. We're talking today? Last time we spoke was almost 2 months ago or so. And our conversation today is timed to the webinar we will be hosting tomorrow. So, I want to ask a few questions regarding Synthesize, your experience with taking it, and some of your own thoughts on it. Are you ready? Of course I'm ready. All right. But first I want to say that I see how you look right now, and I'm comparing it to the video from 2 months ago. I will probably attach this video later. I see that your skin looks smoother, and the color of your face has changed a bit. You seem like you've become younger somehow.
Yes, I noticed that too. Moreover, when I sent you my photo, I took a selfie, and the phone immediately recognized me as a man, 35 years old. So the phone immediately, it said I was 41 years old, but it recognized me as being 35. First 35 years old and then 36 years old. So it took off 5 or 6 years automatically.
Well, all right. Look, you are a practicing trauma doctor, as I understand it, right?
Okay,
Yes. As you know, traumatology is a branch of medicine that studies injuries, their causes, the consequences of those injuries, and accordingly, the methods of treatment. Absolutely right. So, in the meantime, we have already accumulated quite a bit of experience. You could say it's a colossal experience. The use of Synthesize by people when they have injuries, surgeries, burns, fractures. So we see that it all heals faster. It can be several times faster, up to 3 times. I know of one man who healed 4 times faster. So, I'd like to hear your comments on what you felt from the effects of the Synthesize. And as a practicing trauma doctor, who understands a bit more than the average person, understands more than an average person, maybe even a lot more than an average person. He understands the mechanisms. Yes, how wounds heal, what mechanisms are used in the process, and how cells regenerate.
what can you say? What comment can you give regarding the evaluation of the effects of synthes in these cases? There are tissues that regenerate with the help of a scar, and there are tissues that regenerate directly. Unfortunately, most tissues regenerate with the help of a scar. Bone tissue is naturally regenerated directly through the formation of callus and new bone tissue. Skin regenerates directly to a certain extent. Mucous membranes regenerate directly a bit, and adipose tissue and muscle tissue can regenerate directly as well. Tissues like, say, liver parenchyma, heart, lungs, and the central nervous system, including the brain, do not show regeneration as such. In those cases, the body replaces the tissue defect with a scar. If there are specific reviews regarding injuries, burns, and fractures, in both cases, Synthesize improves the direct regeneration of tissues, meaning it restores the skin not through a scar, through the restoration of epithelial cells, of blood cells, and it restores bone tissue. Also, let's say it directly accelerates the formation and regeneration of the callus. Regarding bone tissue, I can give a definite answer that healing fractures always go through several stages. First, there's the initial stage, the hematoma stage. So when the fracture is fresh, hematomas or extensive bleeding form at the site of the fracture. What's characteristic about this hematoma is that since there is a bone fracture, we know that when a bone breaks, the bone marrow is also damaged. If the bone marrow is damaged, then there are always a lot of stem cells in the hematoma at the site of the fracture. So these stem cells definitely help. They help with regeneration. They help in the regeneration of bone. Next, after the hematoma forms, this hematoma transitions into the connective tissue phase, after which it moves into the cartilage callus phase, and then the cartilage callus is directly remodeled. The cartilage callus is directly remodeled into bone. So. And specifically, that's why in traumatology we study how, in fact, bone regeneration is studied empirically all over the world. So we know that, for example, an ankle fracture heals in about 6 weeks. Roughly speaking, a fracture of the radius heals in about 5 weeks, while a femur fracture heals in about 10 to 12 weeks. Why are these time frames, and why does the body choose exactly these periods for the recovery of bone tissue? There is no precise data. There are studies, people are researching in different places, in different clinics, in different institutes, looking into various factors, different growth factors, different mediator molecules. But is there any specific answer? Why bone tissue? Tissue heals in 6 to 12 weeks, not sooner and not later. So if people were saying that a fracture heals 3 times faster, then it's actually synthesizing. And it doesn't just speed up one phase, it speeds up all 4 of these phases. Moreover, there is also a 5th phase. There is a phase after the bone callus forms. There is another phase, the so-called remodeling phase. And when the bone callus is remodeled, we can actually see the original bone in that form on the X-ray, in what it should be, in its anatomical variant. So in fact, synthesizing speeds up not just one phase, it speeds it up. It speeds up all 4 or all 5 phases, meaning that the formation of connective tissue from the hematoma happens twice as fast, and after that it happens twice as fast. Connective tissue turns into cartilage tissue, after which bone tissue forms twice as fast. It remodels twice as fast. So it's a very complex process, but I can assess that if this is a complex process, then it turns out that because bone regeneration is a complex process, if it is accelerated twice as fast, well, then synthesis acts on all its stages, starting from the initial stage.
When, at the moment of the fracture, these stem cells appear, which are released, since the marrow. That's absolutely correct. Absolutely correct.
It's a well-known fact that this is how it is, like the bone marrow in an adult. The bone marrow is the only place in the body where stem cells are constantly formed, meaning it is responsible for blood formation. So as a result of bone fractures, when a hematoma forms, there are always stem cells present in that hematoma. This is the only place in the body where stem cells are constantly formed, meaning it is responsible for blood formation. So as a result of bone fractures, when a hematoma forms, there are always stem cells present in that hematoma.
So, the same thing practically happens when there is a burn or some kind of wound.
The external coverings are affected. There is research in the world. They supposedly found stem cells in human adipose tissue, but there are only a very minimal amount of them. If the skin is restored after a burn, the epithelium regenerates. Most likely the epithelial cells themselves, meaning in the case of skin and in the case of mucous membranes, because there are very few stem cells in the subcutaneous tissue. They were discovered just recently. Based on this, they are trying to develop techniques like the lipogems technique, where a suspension of adipose tissue is injected into the joint to try to stop it. Arthrosis of the hip and knee joints. There are attempts in the world. They are already trying. There are attempts to apply this technique, but it's still very, very new. Officially, according to official data, there are basically no stem cells in peripheral blood. So stem cells are only in the bone marrow. When they are formed in the bone marrow, they immediately differentiate, and from them, blood cells are formed right away. So red blood cells, white blood cells, platelets, that's what we know about hematopoiesis, about blood formation. So stem cells do not leave the bone marrow, and that's why skin regeneration, mucosal regeneration, primarily occurs through the division of epithelial cells, meaning the covering cells or skin cells. And if a person notices that their burn is healing much faster, then one can say that Synthesit not only increases the number of stem cells, but it also enhances the ability of the cells in the mucous membranes or epithelial cells or skin cells to divide.
But only simply that ability, which you see many people, for example, ask the question, can Synthesit provoke, say, the division of certain cancer cells? But at the same time, for example, we recently received feedback that, I will probably show it during the webinar, an 82-year-old woman had a recurrence of skin cancer on her face this year. Last year she was treated, and this year she had a recurrence. And after taking 1 bottle of Synthesit, I got rid of that. So we see that the cells not only didn't become more active in dividing, so these cancer cells, on the contrary, the body seems to have collapsed them.
As we mentioned, the thing is that cancer cells are formed in our body every day. It's just that very few people know about it. In the human body, cancer cells are formed every day, actually every day. It's just that the body, with a strong immune system, or rather not even strong, but with a normal immune system, it destroys these cancer cells, meaning that our system plays a very serious role in the fight against cancer cells. And if a person takes Synthesit and the cancer tumor stops growing, or simply stops progressing, then I think that the main role belongs to the immune system, when the immune system starts to regulate. So this kind of immune system is like the guard of our body, or we can call it the police. So its main task is to notice and destroy all foreign substances in a timely manner and not to touch its own. If the immune system starts to attack its own tissues, unfortunately, the person begins to develop autoimmune diseases. That also exists. These are malfunctions in the immune system. If, however, if the immune system starts to eliminate the tumor, if this tumor stops growing or even begins to regress and disappear, then I believe, as far as I see this process here, the main role belongs to the immune system. Well, yes, so this is another action of Synthesit. What we talked about before, that this has an anti-tumor effect, or rather an anti-tumor and immunomodulatory effect. They can be combined. So definitely the work of the immune system improves. The immune system starts to work much more effectively.
Well, yes, by the way, there's another question regarding, it was previously believed that there were no stem cells in the brain at all. And just recently they started saying that nerve tissue actually contains a certain amount of stem cells. Why is this possible? Yes, the reason I'm asking this is because we have data. You might have seen on our channel that a woman restored her husband's life from a state, so to speak, of being unable to walk, lying down in a vegetative state with the help of Synthesit. And he has been living alone for almost a month now, completely on his own at the dacha. He takes care of himself. He cooks, walks. He hasn't started talking yet after they removed the tumor, 5 centimeters. But it turns out that I understand this, as it were. On one hand, you are a traumatologist, and this is kind of a brain injury. Yes, on the other hand, this is, as it were, again related to stem cells. So, it's possible that if there are these stem cells in the brain, then they help there too.
Yes, that's absolutely right. As I told you once, back when I was finishing university, we were told that stem cells are only found in the bone marrow. Recently, as an orthopedic surgeon, I've been keeping an eye on these events, on these innovations. Just recently, there was information that a very minimal amount is found in the subcutaneous tissue. It's absolutely possible that they are present in the brain as well, and in fact, possibly they can practically be found in every organ of ours, just in very, very minimal amounts. It's possible that synthesize increases their quantity, and by increasing their quantity, it also promotes their division. Look, what is characteristic of the nervous system? For injuries to the nervous system, including strokes, and degenerative diseases of the nervous system. The thing is, our central nervous system, our brain, is something very, very complex. It's such a complicated organ that, in principle, they still can't fully understand or study it. What is the brain? Let's say from the perspective of anatomy or histology, it's an infinite number of neurons intertwined with an infinite number of synapses. A synapse is the connection between nerve cells, and this is how the degeneration of the brain occurs. Degenerative diseases of the nervous system begin, and specialists say that our brain, it loses neurons, but that's a well-known fact. We lose neurons every day. Moreover, our brain, in many ways, yes, according to a lot of data, it loses synapses, meaning that not only the number of neurons decreases, but also the number of connections between them. And this is the second factor that worsens the brain's function over time. So, if the brain's function improves, it is restored. So, a possible option is that Synthesit not only acts on the regeneration of stem cells or the transformation of stem cells into brain neurons, but it integrates these new neurons, which have regenerated into connections with other neurons, meaning it establishes synaptic connections and restores synaptic connections in the human brain, but it definitely improves its function, enhances its performance. Well, yes, I agree here. It's a bit more complicated, that is, than in any other organ. We can say that the cells have recovered. Somehow they divided, either from stem cells or directly from the organ. They have restored, regenerated. The brain is a bit more complex because they're, let's say, just to restore the cells. That's not enough. These cells need to be involved in some common process. And if there are such positive reviews, then these 2 points definitely come into play. And I think that Synthesit can somehow influence both of these aspects, and on the restoration of the cells themselves, and on their integration into interneuronal synapses.
Yes. So look, just a couple of days ago, we received feedback from one of our customers on the website. He himself takes Synthesit. He gives it to his adult relatives. So he writes, he first wrote about himself, then he wrote about his cat, and then he writes about his grandfather. Or his father. To be honest, I didn't quite understand. Now let's talk about a more complex case. Ailes Gamer, 80 years old, has limited mobility, is creating an alternate reality, has high blood pressure, heart attacks, and 2 strokes. So he started giving him Synthesit the first 5 days, 2 capsules, then 1, and on the 6th day, he dressed himself, took a crutch instead of a walker, and headed to work. That's it. They decided to reduce the dose. He takes 1 capsule daily for 3 months. He doesn't take any pills to lower his blood pressure. He doesn't take any accompanying medications with levodopa. Blood pressure has almost returned to normal. Heart rate is normal. Blood is normal. The gaze is clear and confident, always in a good mood. The handshake is strong, without any tremor. The most important thing is that there is no other reality. You can leave it unattended. Synthesit is a miracle, no exaggeration. That's what you were just talking about.
Well, yes. Besides that, I can add a bit more information about Alzheimer's disease. What I heard is that the person was taking levodopa or L-dopa. This is what's called a precursor molecule, or a progenitor molecule, dopamine precursor molecule. There is a dopamine theory of Alzheimer's disease, which states that in our brain there are so-called basal nuclei, and in these nuclei, specifically in these interneuronal synapses, the mediator is dopamine, and Alzheimer's disease. It starts because the synapses in the basal nuclei get depleted, and they, in a way, become exhausted. Their dopamine levels drop sharply, meaning the synapses are left without a mediator and stop functioning. And they add, it's like a molecule, a precursor, because dopamine can't cross the blood-brain barrier to get into the central nervous system. That's why L-DOPA was invented as a precursor molecule that can enter the central nervous system, get involved in metabolism in our neurons, and from it, dopamine is formed in the neurons. Dopamine enters the synapses as a mediator, and the synapses start to function normally. If a person stops taking L-DOPA and achieves almost the same effects with the help of Synthesit, then one can assume that Synthesit somehow aided in the synthesis of dopamine as a mediator in the neurons of the brain, in the basal ganglia or in the basal nuclei. So that's the third effect. So it turns out that it has normalized the metabolism of the neurons in the brain.
Yes, that's very interesting. I think that in the future, of course, all of this will be studied from different perspectives. And now, let's maybe look at it from the perspective of a practicing doctor. For those people who, let's say, will be taking Synthesit for various types of injuries of different origins, could you recommend if there's anything else they should take in addition to Synthesit? Perhaps some herbs, I don't know, maybe some additional supplements to support the process and, so to speak, not to just deplete the body's reserves if a person, for example, has a not so good diet. It's clear that the body will extract the necessary substances from its reserves in order to recover. How can I support myself? Subtitles made by Dima Torzok. Alexander, the microphone is off.
I apologize. Is it really like that now? As an orthopedic doctor, I can't give any specific recommendations because these things are handled by a new branch of medicine that is currently developing all over the world, integrative medicine. Personally, what I can say about myself is that I take Synthesit with multivitamins, basically. One simple recommendation, general recommendation that I can give. What? Synthesit should be taken with substances that help the absorption of iron. First of all, it's vitamin C, perhaps. Vitamin C, B vitamins. So you can absolutely take supplements and multivitamins without any worries. I do that myself. The only thing is, yes, well, just a little bit, be a bit more careful, as it's a well-known fact that iron is not absorbed with two substances. The first known fact is that calcium interferes with iron absorption, so you need to somehow separate it a bit or do it in the form of separate meals. If a person consumes any dairy products, then, well, I think it's worth taking a break for a few hours. And second thing that interferes with iron absorption is polyphenols. So if a person is taking supplements with polyphenols, then it's also worth taking a break for a few hours. Just let's say first pass through the digestive tissue, through the small intestine, let's say one medication or one substance and then another. If iron is taken together with calcium or iron with polyphenols, then calcium and polyphenols worsen the absorption of iron. The absorption of iron.
And if anything... Excuse me, I was wondering, do polyphenols actually exist in regular foods such as fruits, vegetables, and grains? Or are they exclusively found in supplements?
As far as I know, they are mainly found in supplements. Polyphenols are compounds or substances that help another important substance or molecule, such as vitamins and minerals, to be absorbed in the body, ensuring optimal health. This is omega-3 with fatty acids. From time to time, they add polyphenols through regular food. I don't think so. I haven't come across such information. So those who take omega-3 should be careful to check if there are polyphenols and what the content of polyphenols is. In principle, they can take it without any worries. In that case, I recommend taking a short break of a few hours between taking the Synthesit and taking, let's say, another supplement.
All right, Alexander, maybe to wrap things up, can you tell us what has happened to your body with the help of the Synthesit over these 2 months and overall?
Well, as I mentioned, my memory has improved, attention, concentration, and my coordination of movements has also gotten better. Right now, I've noticed that my speed of movement is starting to improve. And now, I've noticed that I'm slowly starting to lose some extra weight, especially now. Well, I don't really do sports. Well, after work from time to time, well, I don't do sports. Well, after work from time to time, well, or a light jog, or I'll go for a walk in the woods, or I do some simple things like that. And despite that, I'm starting to lose weight. I'm starting to sleep better. I sleep a little for 5, 6 hours a day, but I see that it's absolutely enough to get a good night's sleep. So these are very diverse effects. I'm very sick. All right, okay.
Thank you very much for the interview. All the best. Health. Goodbye.